Alright guys, welcome back. Today we'll cover CPAP versus BiPAP, specifically their uses in the critical care setting. So we'll go ahead and get right into it here, starting with CPAP. So CPAP stands for Continuous Positive Airway Pressure. Airway pressure. Okay, so with CPAP, this continuous positive airway pressure is referring to just one singular continuous pressure that will be present throughout the breathing cycle. So we'll say a single continuous pressure throughout the breathing cycle. So inhalation and exhalation, right? Throughout the breathing cycle. How I like to, or how you can think about the CPAP is you can think of it as basically it's PEEP for non-intubated patients, right? We'll just talk about this in a second, but CPAP, PEEP, so positive end expiratory pressure for non-intubated patients. And the theory behind this is if you think about PEEP and the benefits of PEEP, so PEEP is going to help improve oxygenation, right? How does it do that? It does that by preventing atelectasis, so preventing the alveolar collapse and expanding surface area for gas exchange. Both of those combined are going to help to improve your oxygenation, and that is exactly how CPAP works as well. So the benefits to the patient here, it's going to improve oxygenation, and it does this through preventing atelectasis, remember, atelectasis is just alveolar collapse, right? It keeps the alveoli open, it helps alveolar recruitment for other, and it's going to improve or expand surface area for gas exchange. For gas exchange. And both these here are going to work to help improve that oxygenation. So with CPAP, generally this is going to be indicated. So indicated if it's improving oxygenation, then it's indicated for hypoxemia, right? Low levels of oxygen in the blood. Okay, typically with CPAP, your normal settings here, it's just going to be, you're going to have one set pressure, so one pressure, and your FiO2 setting. And this pressure is typically set somewhere between 5 and 10 centimeters of water. Okay, so that's just a quick one of CPAP. Now let's move on to BiPAP, and we'll talk about some of the differences here. So BiPAP stands for Bilevel Positive Airway Pressure. So with BiPAP, here you're going to get two different pressures that are going to be delivered, one during inspiration and one during expiration. So we'll cover those here. So it delivers two different pressure settings. Okay. The first one is IPAP, also known as inspiratory positive airway pressure. Inspiratory positive airway pressure. So this here, your inspiratory positive airway pressure is going to assist in inspiration. So basically going to give the patient like a little boost, right? Which is going to help them have larger tidal volumes, so take bigger breaths. And we'll talk about why that's important here when we get to talk about hypercapnia and blowing off more of that CO2. So what this does, assists inspiration, which is going to lead to larger tidal volumes. Okay, the other setting is expiratory positive airway pressure. Expiratory positive airway pressure. And you can think of this as PEEP. So very similarly, right? Here and here, what does PEEP do? PEEP is going to work to, once again, it's going to improve oxygenation the exact same way, right? Keeping the alveoli open, expanding the surface area for gas exchange. It's going to improve oxygenation that way. So it does that. Once again, prevents atelectasis plus expanded surface area for gas exchange. Expanded surface area. Okay. So with BiPAP here, this is going to be indicated for, so it can improve oxygenation just like CPAP, right? So that could be hypoxemia. Where it differs here is with this inspiratory pressure to help take larger tidal volumes. It can help improve hypercapnia. And remember, hypercapnia just refers to elevated CO2. So someone with CO2 retention, whether this is from a traumatic brain injury, drug overdose, respiratory failure, whatever it may be, basically they're not removing enough CO2, so they might not be taking enough breath, or they might not be taking large enough breaths. So remember this. We got to remember here that tidal volume is just the amount of air that's moved in and out during a normal breath. During normal breath. So by increasing this tidal volume with this inspiratory pressure, you're going to get more air in and eventually more air out, right? And that's going to just basically help blow off more CO2, get rid of that CO2. So that's how it can help improve that hypercapnia. So basically, put things short, it not only does it improve oxygenation, it also improves ventilation as well. And just a quick reminder, so remember oxygenation, that's also with CPAP here, improving oxygenation only. That's the main big difference that we'll need to know here. So oxygenation is the process, this is getting O2 from the alveoli into the blood, right? From alveoli into the blood. While ventilation, this refers to the process of moving air in and out of the lungs, which is all about that CO2 removal. Okay, now as far as settings, so it's once again 2 settings. It's always inspiratory over expiratory. So normal range is here. You'll see something 10 to 20 centimeters water over 4 to 10 centimeters of H2O there. Okay, so that's just kind of a quick overview there. The main things here to know is that here the CPAP, right, it's going to improve oxygenation, so it'll be indicated for hypoxemia. So it's just that one pressure throughout the breathing cycle. Think of it as PEEP, right? It's keeping the alveoli open, preventing atelectasis, improving the surface area, better gas exchange, better oxygenation. Whereas BiPAP provides a little more support, right? So you've got this inspiratory support, and what this does, assisting inspiration, increase tidal volumes, which is going to help blow off CO2. So that is how it's going to help with not only oxygenation, but also ventilation. So hypoxemia and hypercapnia. And like I said, the EPAP here, you could think of it just like PEEP and CPAP. It's improving oxygenation the exact same way. That's what we talked about, the preventing alveolar collapse, expanding surface area, better gas exchange, better oxygenation. So that's just a quick overview there of the differences of CPAP and BiPAP. If you learned anything, please subscribe. I'd really appreciate it, and we'll see you on the next. Thank you.